In this lecture, we will discuss the most important antihypertensive drug, and that is Captopril. We will cover the all aspects of the Captopril, and at the end of this video, you will be able to know about the major aspects of the Captopril. So let's get started. Starting from the structures of the Captopril and the most important component present in the Captopril, and that is the sulfhydryl group SH, and that is the main group that helps in the binding of the captopril with the ACE, that is angiotensin converting enzyme. So if we look at the mechanism in our body, in the normal situation, angiotensin 1 converts into the angiotensin 2 with the help of the enzyme, that is ACE, angiotensin converting enzyme. Now, angiotensin 2 performs lot of function in our body. Like the first function is the vasoconstriction. In normal situation or in our daily life, when we see the water pipe or when we constrict the water pipe, the pressure of the water increases. Similarly, in our body, when the blood vessel constrict, so ultimately pressure in the blood or the blood pressure will also be increased. So that is the important thing done by the angiotensin 2. Next is the angiotensin 2 also causes the retention, increase in the retention of the sodium and the water, because it actually increase the production of the aldosterone, that is a hormone. This aldosterone increases the retention of the sodium, and due to the retention of the sodium, water will also be retained in our body and the blood volume increases in our body, and ultimately it causes the increase in the blood pressure. Next, ADH, antidiuretic hormone. Whenever you see the productions of the ADH in your body, the urine volume will decrease because water will retain in your body. So that is the important hormone, ADH, antidiuretic hormone. So you have to remember it with the this technique, ADH inversely proportional to the water. Whenever you see the increase in the productions of the ADH, then you will see the decreased water in the urine. So urine volume will be decreased due to the decrease in the release of the water from the body in the form of urine. So these are the important things that is done by the angiotensin 2. But what will happen if captopril block this enzyme ACE, angiotensin converting 2? Basically, captopril blocks this enzyme, and ultimately all these process will be reversed. And you see in this case, what will happen when we inhibit the ACE with the by taking the captopril? So, first of all, angiotensin 2 increases the vasoconstriction, but it decreases the vasoconstriction. Due to the decrease in the vasoconstriction, the ultimately blood pressure will decrease. So that is why we take it as antihypertensive drug. Next, as we know, when we block the ACE, angiotensin 2 will not be produced, then ultimately aldosterone level will decrease. And due to the decrease in the aldosterone level, sodium and water retention in our body will also be decreased, and ultimately the volume of the blood will decrease, and that causes the reduction of the blood pressure. Similarly, in the ADH, antidiuretic hormone, by blocking this enzyme, there is no angiotensin 2. Ultimately, there will be a decrease in the production of the ADH, and ADH is a hormone that causes the retention of the water in our body. When its production reduced, then the lot of water released in the form of the urine. So ultimately, the urine volume will increase in that case. Next, the most important ACE inhibitor. ACE inhibitor causes increase in the production of the bradykinin, and that causes the vasodilation, increase in the size of the or the bore of the blood vessels, and Along with that, bradykinin can also cause the dry cough and the angioedema, swelling on the face, swelling around the periorbital area, like around the eye, on the face, on the lips. So these are the different forms of the angioedema. Another important thing, we have glomerulus, through which you will see the filtrate enter into the Bowman's capsule. This is the structure of the nephron present in our kidney. So the blood enter into the glomerulus, that is the glomerulus. Here is the capillary-like structure. Blood enter into the glomerulus through the afferent arterioles, A for afferent, and it releases the glomerulus through the efferent arterioles. When by taking the captopril, the size of the efferent arteriole increase or efferent arteriole dilate. Then ultimately glomerular filtration rate will decrease. Why? So it's like this one. Here is the condition. Whenever the fluid enters through a small hole or pore, and ultimately when it gets large bore at the end of this pipe, then ultimately it has lot of place of exit. Then ultimately you will see the pressure will decrease in that case, or you can say the filtration will be slow in that case. So similarly, afferent arteriole is not affected by this one, but the size of the efferent will increase or the dilate. Then ultimately the normal glomerular filtration will be decreased in that case, and that is helpful in the diabetic nephropathy, and it prevent it from the proteinuria, release of protein in the urine, because there is problem in the diabetic patient, kidney problem in the diabetic patient. Then ultimately by taking this captopril, the normally that is protein present in the urine in the diabetic patient, so you will never see the protein in the urine by taking the captopril. Next, captopril will not be taken along the meal because it decreases the absorption of the captopril in our GIT. So it must be taken 1 hour before the meal. Otherwise, you will see less absorption of the captopril through the small intestine. And captopril is metabolized in the liver and it converts into the active form, and ultimately then it performs its function. And excretion, it excreted through the urine. That is the major route. So kidney impairment or the proper kidney function, you have to check by going towards the RFT test, renal function test, whether the kidney of the patient is functioning properly or not. Therapeutic uses, first is the most important, hypertension. It's an anti-hypertensive drug. It decrease in the blood pressure. That is the first line drug, and it is used in the diabetic patient, heart failure patient, and the CKD patient, chronic kidney disease patients. Next is the congestive heart failure, CHF, when the blood congested in your heart, when the heart fails to perform its function. So it decreases the afterload, preload. What is this? Preload, when you see preloads mean the ventricle filled with the blood. So that is the preload. When the preload is decreased, it means that there is less filling of the ventricle by the blood. Then ultimately when there is less filling of the ventricle, then you see the decrease in the pulmonary congestion, because from the right side this blood goes towards the lungs, and at the left side you will see the remaining blood from the lungs enter into the left side of the ventricle. So it prevents the pulmonary congestion. That is the important thing. Next is the afterload, how much work ventricle has to done against the pressure. Then ultimately, when you see the decrease in the afterload, decrease in the pressure done by the ventricle, then ultimately cardiac output will be increased. Blood release from the specifically left ventricle throughout the body. So large amount of the blood can be released from the left ventricle. When the left ventricle, that is the most important, when the left ventricle pump all the blood enter in throughout your body. So that is the important thing. It is important in congestive heart failure because it reduces the after load and ultimately increase cardiac output. It decreases the preload and that causes the decrease in the pulmonary congestion. Next, it can also be given in the post myocardial infarction because actually heart is already damaged. So you don't have to put strenuous exercise or the on the heart. So ultimately, it is given in the post myocardial infarction, and it must be given within the 24 hours. And next is the diabetic nephropathy. As we have already discussed, it dilates the efferent arterioles in the nephron, so it is good for the diabetic nephropathy. Side effects, you can see the dry cough. You can also see the hypotension, low blood pressure, very low blood pressure, headache, angioedema, hyperkalemia, that is the decrease in the productions of the aldosterone that causes the increased level of potassium in your blood. So you can monitor the hyperkalemia by doing some blood test like the serum electrolytes, and its taste is metallic taste. You can also face the dehydration. You can also see the neutropenia in the CBC report, low count of neutrophil, and renal failure can also be seen in that case. So these are the different adverse effects, or this is the uh, general overview of the captopril. So if you still have any question, you may ask in the comment section. Thank you so much.